Hi, my name is Elena Fajardo, and I will be reviewing Chapter 16, Palliative and End-of-Life Care from the Merck Manual of Health and Aging. So why is end-of-life care planning important? End-of-life care planning is important because more than 3/4 of deaths in the U.S. are due to chronic diseases such as heart disease, cancer, stroke, chronic obstructive pulmonary disease, and dementia. However, although such a large portion of the deaths in the US are due to chronic diseases, very few individuals plan for extended life care. And although the healthcare system in the US is set up to extend life as much as possible, it's really not set up to offer the support and palliative care that's required with extended diseases. And when asked, goals of individuals with life-threatening chronic diseases are really very simple. They want relief from pain and symptoms. They want to be involved in their decisions about care, and they want the assurance that their wishes will be honored or respected. They also want to be relieved of any burdens on their family or friends, and they want to have a sense of completion at the end of life. Signs of approaching death. This is important for a lot of people, not only as the individuals who are being affected by that chronic disease or afflicted by that chronic disease, but also this can be important for family members and for friends because they just want to know what signs to look out for and how much time their loved one will have when these signs start to show. Um, so one of these signs can be a change in level of alertness. The individual will start spending more time sleeping. When they're awake, they may be less alert or interactive. They can also start showing signs of confusion or disorientation. They will also have a decreased interest in eating or drinking. They'll have an absence of urination, and when this occurs, death usually follows within a few days to a few weeks. They can have changes in skin, so their hands or feet will become cool or bluish or develop a lacy pattern. And when this happens, death is likely to occur in hours to days. You can also likely notice changes in breathing. So breath will become rapid and shallow, or it might alternate between periods of really slow and rapid breathing. They could also potentially stop breathing for increasingly prolonged periods, only to begin breathing again. And there's also something called a death rattle, which is a rattling noise when breathing caused by the accumulation of secretions the dying person cannot swallow or spit out. And it can also be caused by relaxation of muscles in the throat. This can be really scary for family members, but it's not for the individual because they usually can't hear it. One of the goals of end-of-life care is to reduce the individual's suffering or pain. Possibilities are pain relievers, such as analgesics, or massage or heat. Opioid analgesics are also a possible treatment. However, side effects do include constipation, sleepiness, confusion, nausea, and itching. Shortness of breath and coughing. Causes could be due to infection, spread of cancer, fluid accumulation in or around the lungs, fluid collection around the heart or in the abdomen, blood clots in the lung, or compression of large veins in the chest due to cancer. Possible treatments. The number one treatment is to treat the underlying cause of the shortness of breath and coughing. However, if that's not a possibility, then relief can be found by sitting up, breathing cool air, the use of a fan, physical touch, massage, oxygen therapy, and moisturizing the air by humidifying the air. Digestive problems can also be encountered. Some of these are nausea and vomiting, which could be caused by opioid and anti-cancer drugs, constipation, infection, sores or ulcers in the mouth, esophagus, or stomach, blockage of the stomach and intestines, liver and kidney failure, altered calcium and sodium levels in the blood. Loss of appetite can also occur. This could be caused due to difficulty chewing due to dry mouth sores, mouth infections, or difficulty swallowing due to a tumor, Severe pain, nausea, constipation, or changes in taste due to illness or treatment can also affect appetite. The most common cause is due to a serious disease such as cancer or infection, and it can cause cachexia, aka significant weight loss. Mouth problems can occur, and these can be caused by ulcers due to anti-cancer drugs, fungal infection, dryness from radiation treatment, or dehydration and poor hygiene. Treatment would be frequent sips of liquids or sucking on ice chips, brushing the teeth 2 times a day, and rinsing with an anesthetic solution. Constipation can also occur, and this can be caused by sedentariness, dehydration, little dietary fiber intake, constipating drugs like opioid analgesics, the inability to get out of bed, confusion, depression, spinal cord compression, intestinal blockage, and high calcium levels in the blood. Treatment would be periodic walks, sucking on ice chips, or taking small sips of liquids, bedside commode so they don't have to walk as far to go to the bathroom, laxatives, enemas, and you really want to avoid increased fiber intake because this can cause more harm than good. Diarrhea can also occur, however, it's much less common in constipation, and it could be a sign of constipation, and the body is just trying to flush out that blockage by causing diarrhea. Um, so some causes of diarrhea could be anti-cancer drugs, antibiotics, laxatives, cancers, surgery on the stomach or intestine, or like mentioned before, it could be a sign of constipation as well. Treatment would be anti-diarrhea drugs such as loperamide and diphenyloxide. Another potential problem that you can encounter near the end of life would be inflammation of the anus. This can be caused due to constipation, diarrhea, changes in the skin and lining of the anus that may occur if weight is lost, and increased pressure on the skin during long periods of sedentariness. So treatment would be zinc oxide and corticosteroid creams. Pressure sores, aka bed sores, can also be encountered towards the end of life, just because it's caused by lying for long periods without moving. Treatment would be reducing pressure, changing positions frequently, applying dressings, removing dead tissue, and maintaining proper nutrition. A way to prevent bed sores would be by changing positions frequently, cushioning areas prone to sores, such as the heels, ankles, hips, and lower back. And it's really important to remember that prevention is easier than treatment. Itching is also something that many people deal with towards the end of life, and this can be caused by incontinence, sweating, poor hygiene, dehydration, dry skin, dermatitis, and other skin conditions, and liver or kidney failure. However, often the cause is unknown. When the cause is known, the most preferred type of treatment would be to correct the underlying cause, but moisturizing and corticosteroid creams and drugs that decrease the itchiness, such as antihistamines, are also really good treatment options. Fatigue is extremely common and often due to many factors. It could be caused due to pain, low blood oxygen level, organ failure, drugs, infection, or depression, or a combination of all these. So treatment would be to just allow them to rest as much as needed. Analgesics, sedatives, erythropoietin, which increases blood cell count, and occasionally psychostimulants are used, such as methylphenidate or dextroamphetamine. Anxiety is also something that is encountered and is common in people with life-threatening chronic diseases. Triggers can be pain or shortness of breath, new symptoms, drugs, family conflict, recognition of one's own mortality or limitations, fear of abandonment, regret over past actions, and financial concerns. So it's important to recognize when it's a problem, and it becomes a problem when it overwhelms their thoughts or limits their ability to do what they want to do. Relief can be found by just providing emotional support or reassurance from family or friends or health practitioners, and also just really patient explanations of symptoms, treatments, and choices so they understand what's going on with their bodies and what to expect. Music, prayer, relaxing activities can also help, and if all the other measures fail, then anti-anxiety drugs such as benzodiazepines and antidepressants can really help manage anxiety.